I'm Dr. Sadanand Patil. I'm a medical oncologist. I work out of the offices from Baptist East and Baptist DeSoto. I have a special interest in lung cancers, melanomas, and GI cancers. Keeping a regular bowel habit during cancer treatment can become quite difficult and critical at times. When the bowel movements exceed the normal limits, it's called diarrhea, and when there are no bowel movements for many days, it's called constipation. There are many reasons why a cancer patient is more likely to get either diarrhea or constipation. Let's start off with diarrhea. When there are chemotherapy medicines which the patients get, some of them directly can cause irritation to the intestines and cause loss of the epithelium of the intestine, causing diarrhea. Further, some of the patients can get radiation treatments to the bowel area, and radiation can make diarrhea worse. Further, when some of the patients can have cancer directly involving some parts of the intestine, and that can cause diarrhea. And nutritional problems, people not eating enough during chemotherapy or not drinking enough fluids can make the problems from diarrhea worse. If a normal person would be able to handle a certain amount of watery stools, but if someone who is already dehydrated and loses more fluid through the stools would become very rapidly dehydrated and can even require hospitalization. Some warning signals everybody needs to know about when a constipation can become serious enough that you need to talk to your doctor or even go to the emergency room. For diarrhea, if you're having more than 6 watery bowel movements a day, that's too much for anybody, especially a cancer patient to keep up with. If the diarrhea is so bad that that your body becomes dehydrated and you're not going to the bathroom to make urine anymore, that is an indication that you're dehydrated and will require either medical assistance or hospitalization. If there is severe pain in the abdomen associated with the diarrhea, or if the diarrhea is associated with nausea and vomiting, it can cause electrolyte imbalances, which can cause further problems, and you will need to talk to your doctor or go to the emergency room for this. As for constipation, normal bowel movements vary significantly among people. Some people go to the bathroom every day and some every 3 or 4 days. But if it comes to a point where you want to go to the bathroom, but you feel really tight and you're not able to go to the bathroom, that's a time you need to talk to your doctor about getting medications treatment for that. If the constipation becomes severe enough that you're not able to maintain your nutrition, if you're not able to eat enough, or if you're actually throwing up, then that's definitely a time to talk to your doctor about it. What do you do to keep the diarrhea or constipation from getting bad? When someone gets diarrhea, the biggest problem is you could get dehydrated. And dehydration causes a lot of electrolyte imbalances in your body, and it can, an exact balance of electrolytes is essential to keep your body functioning right. What you need to do is to make sure you drink enough fluids. A normal person requires about 8-ounce glasses of water a day. You can either drink it in form of water or electrolyte solutions like Gatorade or other fluids. But I would definitely recommend against using a lot of carbonated beverages, because carbonated beverages can make you more nauseous, especially in the setting of chemotherapy. Further, when you actually have diarrhea, you should try to restrict the amount of fiber you take in your food, because that's going to make your diarrhea worse. Try to drink as much clear liquids as possible, and like Jello or grape juices, and avoid high bulk food like bananas or other fruits or meats. you try to keep up your potassium, which is a critical element when you get diarrhea. Foods rich in potassium can be bananas, apricots, if you need to keep up with these foods, or at times take potassium supplements. And the basic thing is to try to keep up with how much fluid you lose through the diarrhea. You have to make sure you get at least equal or more of that in your intake. To prevent constipation and to relieve constipation, say someone is on a pain medication, a narcotic pain medication, which is known to cause constipation. Most of our patients who are on these kind of medications, we also put them simultaneously on a stool softener or a laxative. If overuse of laxatives, however, can also make the constipation worse. If you have been using laxatives for a very long time, it is like flogging a tired horse. The laxatives wouldn't have enough effect on your intestines to push your stools down. So you have to take laxatives in moderation, but you have to use it when you need it. Adequate fluid intake and adequate fiber intake is essential to keep your bowels moving regularly and to avoid constipation.